NGS is a platform examining the chromosomes in the embryo, especially in the genetic screening procedure called PGTA. There are approximately 24 types of chromosomes in humans and in NGSs. We examine these 24 types one by one. While examining 5-6 chromosomes in normal scans, especially plug-in scans, all chromosomes from that embryo are examined numerically, or in terms of deficiency and excess, and the pregnancy rates of patients increase slightly when NGS gives positive results. The uterus resting method is also medically known as freeze-all, that is, all embryos are frozen and transferred at a later date. There are groups that advocate very strongly for this method, especially those that tell all their patients to freeze their embryos, then transfer them after resting for 1-2 months. However, when we look at the studies around the world, and in the report by the American Reproductive Society, it states, particularly in families with large numbers of eggs, hormone levels increase, such as estrogen and progesterone, and when these hormones rise, it can prevent the baby from settling in the uterus. Therefore, embryos are frozen to eliminate this issue, and then after 1-2 months, when our hormone levels go down, the in utero is prepared, again the embryo is implanted. We also use uterine resting methods in our clinic quite substantially. However, especially in patients with reduced ovarian reserve or normal ovarian reserve, we avoid it to some extent because studies have shown that it sometimes has a negative effect. And particularly in patients with polycystic ovarian syndrome or patients in which we find a lot of eggs, we also employ the uterus resting method. We have the ERA test, which stands for Endometrial Receptivity Array, and is a method usually applied abroad. The main purpose is this. If we describe it with the metaphor of the soil and seeds, it is like analyzing soil. You know that the agricultural engineers take samples from the soil and say, yes, it would be better if this is planted here. This is the basic logic in the ERA testing. We take a sample from inside the uterus, the area we call the endometrium, and we decide on which day and when the embryo will be transferred. It is a little laborious to carry out. First, we collect the eggs and freeze them, then prepare the uterus for the ERA, and then take a biopsy from the uterus immediately after. The biopsy we get is examined by the genetic laboratory, passed on to us. According to the results, we start to prepare for the transfer of the frozen embryo to the patient in the upcoming month. This takes about 3.5 months. It can be beneficial. The ERA test was first introduced about 6-7 years ago. With each passing day, it is being improved and made available for use.